It's 1984. I've got my dream job. I'm working in the busiest intensive care unit in the city. The sliding doors, the whoosh of ventilators, the beeps, the alarms, the pumps, the equipment. I love it. 2 years in, I'm still considered a novice nurse. My nighttime reading consists of Swan-Ganz catheter care, pulmonary artery pressures, advanced hemodynamic monitoring, Starling's law of the heart, neurodynamics, on and on and on. And I still have so much to learn. I come in to work one day for the first of 3 12-hour day shifts, and I get my patient assignment. Maggie, 36 years old, unconscious, Glasgow coma scale of 3. Stop right there. I really wanted to be on the code team. They continue. Maggie had a massive stroke following the delivery of a healthy baby girl. Probably amniotic fluid embolus. She's not expected to survive. She's considered brain dead. We're looking at organ donation. That's my assignment for 3 days. I look at the orders, standard coma care, prognosis grim, neurovital signs Q1H, drops in the eyes, tape eyes shut to preserve the corneas, monitor, turn, mouth care, ventilator settings, head of the bed elevated, talk to the family. I do my hourly checks, drops in the eyes. Maggie, Maggie, can you hear me? Squeeze my hand if you can hear me. Open your eyes. Nothing. Every hour, the same. Drops, tape, shut eyes, turn, monitor. Nothing changes. Day 2, I come back, stable. I get my report for the night shift. Maggie's been stable overnight, no change. I start my day, drops, check pupils, tape eyes shut, turn, monitor, no beeps, no alarms, everything is calm. Day 3, this is the day when we'll do all the tests to determine Maggie's brain function. We'll do EEGs, CAT scans. Other nurses murmur over the bed as they help me with turns. Oh, tragic, poor thing, her poor husband. Isn't this awful? This is so sad. I start my day, open Maggie's eyes, take off the tape, drops in the eyes. I move down to her arms, pinch her fingers. Maggie, Maggie, wake up. This is your last chance. Squeeze my hand if you can hear me. Go down to her toes. Maggie, Maggie, wiggle your toes. Nothing. She just lays there. I glance up. Oops, I forgot to tape up her eyes. And then I notice a flicker. Could her eyelid have flickered? This doesn't make sense. Back up to the head of the bed. Maggie? Blink. Oh my goodness, what is this? Maggie? Blink once if you can hear me. Blink. I run out to get the nurse clinician. 25 years in ICU, she must understand what's going on. She comes to the bedside. Her indulgent smile and her shrug speaks volumes. Probably just reflex, Karen. It's okay. But maybe you could bring it up in rounds. 10 o'clock. All the doctors are assembled outside the glass sliding doors of Maggie's room. I give my spiel. I'm nervous. Yes, hourly vital signs, urine output, ventilator settings. I go through list by list. Then I take a deep breath and I say, but there's something kind of strange and I don't know what it means, but I think she can hear me. Snicker, snicker, laugh, laugh, rolled eyes. I hear someone whisper, she's an organ donor. I say, but I told her to blink and she did. The neuroresident pipes up, oh, we won't see anything on her EEG, that'll tell the tale. I assessed her myself this morning and she was non-responsive. Asshole, I whisper. I said, but I asked her to blink twice and she blinked twice. So then another resident pipes up. Maybe she has locked-in syndrome. Locked-in syndrome? I've never heard of that. I listen attentively and the resident explains how locked-in syndrome results from brain injuries in the brainstem and the pons, and it means that the person's brain is alive and they can hear and they understand, but they can't do anything. It's like their brain is disconnected from any voluntary motor function. My heart thuds. I think to myself, how terrifying. If she's really alive in there, she's heard us talking about taking her organs and turning off the ventilator. Oh my God. So I just can't process how this could happen. But I believe him. Maybe it is locked-in syndrome. And I think about how I, as a nurse, was so focused on my monitors and my buzzers and my machinery and my hourly intakes and outputs and mouth care, that I, with my gauze and my drops and my tape and my good intentions to save those corneas, had blocked off Maggie's only way to tell me she was in there. And in that moment, my nursing changed. I paid attention. I looked for detail. The monitors weren't so important. I knew that any body, however broken, battered, or attached to life support, had something to tell me, if only I looked. Just like Maggie, with the simple blink of an eye, told me she was there.